Good evening, everyone, and thank you for being here to learn about this issue. My job is to give you a 5-minute introduction to fentanyl, which is not a lot of time, so we'll get right into it. So to start with, I want to bring up this study that came out recently. It showed that teen overdose deaths are rapidly rising, although even less teenagers are actually using drugs. And the study actually showed that the number of teenagers that reported using drugs in the past year has stayed about the same over the last 10 years at about 30%, which is a number that still may shock many of us, but um, that number has actually even dropped to less than 20% in 2021. The number of teenagers who died of overdose has also stayed pretty much the same between 2011 and 2020, at about 2 teenagers out of 100,000. However, in 2020 and 2021, that number has more than doubled to over 5 per 100,000 in 2021. So the question is, why are less teenagers using drugs but more of them dying? And the answer is one word: fentanyl, which is a type of opioid medication. So I'm going to start with the very basics. What are opioids? Opioids are a class of medication that work on the opioid receptors in the human body. Opioids can be naturally occurring chemicals that come from opium, seen here on the right, or they can be synthetic. Natural examples include morphine, which is the active chemical in opium and was discovered in the 1800s, heroin, which is a slightly stronger version of morphine, and hydrocodone and oxycodone. Other opioids are synthetic, meaning that they're chemically designed to work on the opioid receptor, but are made in a lab as opposed to coming from plants. And examples include methadone and fentanyl. Fentanyl is a synthetic opioid first created in 1959. It is 100 times more potent than morphine. And why is fentanyl useful? Because having a powerful medication can often help doctors more effectively treat severe pain, for example, during surgery or severe trauma. So what do opioids do? Opioids, like I said, bind to the opioid receptors in the human body like keys opening different locks. And the effects of opioids are following: pain relief, drowsiness, euphoria, slowed breathing, slowed heart rate, and constipation. Opioids are dangerous because the drowsiness and reduction in breathing rate can lead to overdose and death. Why are opioids so addictive? This is a trick question because addiction is a complicated disease with many different factors, including biological factors, psychological factors, and social factors. I don't believe opioids are the cause of addiction. However, as we talked about, they are dangerous because of the possibility of overdose and death, and they are also very hard to quit because of two important physiological concepts: tolerance and withdrawal. Tolerance means that as you use a substance for longer periods of time, you need more and more of the drug to get the same effect. In fact, many people with an opioid addiction will say that the drugs no longer make them feel good, but that they need to use high doses just to feel normal. And that brings us to the second concept, which is withdrawal. Withdrawal just means that when you do not have enough of the drug to feel normal, you start experiencing the opposite symptoms as intoxication. In the case of opioids, these symptoms include pain, anxiety, restlessness, vomiting, or diarrhea. So why is fentanyl so dangerous? Because fentanyl is so potent, small amounts and very small differences in the amount of fentanyl in a drug can be the difference between life and death. This is what is often talked about in the news when they refer to a bad batch of drugs. It often contaminates other drugs like fake Xanax or fake methamphetamines, which means that people who are not used to opioids and don't have the tolerance may accidentally be exposed to a very dangerous dose. And sometimes opioid users actually seek out fentanyl. As people spend more time using, they develop tolerance and start seeking stronger and stronger medications to get the same effect. Once people start using fentanyl, however, the withdrawal symptoms become much worse and it can be much more difficult to quit. So what can you do? By being here, you're learning about the problem, you'll learn about naloxone, and learn about other services in the county that'll help people that are struggling with addiction. In this last 30 seconds or so, I'd like to talk a little bit about treatment. Addiction is complex and it's a hard thing for many people to talk about, including people like me who spend their whole day trying to help people who struggle with addiction. And I often find it useful to use metaphors. People might think of recovery or sobriety as natural, but in fact it is a skill to be learned, just like riding a bike. No one is born learning how to ride a bike. It takes practice and patience. It takes learning how to balance, learning how to train certain muscles to perform actions at certain times. And learning to be sober is no different. You can also fall down while riding a bike. And when we talk about fentanyl, however, falling down can mean something very bad happening, like an overdose or death. It's important to understand that treating opioid addiction, especially for fentanyl users, absolutely must include a discussion on medication-assisted treatment. Medication-assisted treatment, or MAT, includes using two very specific medications, Suboxone and Methadone, to help people recover from opioid addiction. And if we continue this metaphor, I often talk about methadone or Suboxone as training wheels that help people learn how to ride a bike. Training wheels help people learn how to develop their strength and balance, feel normal, and more importantly, keep people from falling down until they are ready. No one expects to use medications forever, just like no one expects to use training wheels forever. In the future, I hope that I'll have the opportunity to talk to you more about medication-assisted treatment. In the meantime, as I said, please send me any questions you may have. Thank you for your time. Thank you for being here to learn about all this.